Temporomandibular joint dysfunction, or TMJ, is not uncommon. Divers regularly complain of pain or tenderness in the jaw, or a headache or aching facial pain after diving. The gripping action required to hold a mouthpiece in place may strain the muscles used for chewing, the masticatory muscles, or the temporomandibular joint, TMJ, which connects the jaw or mandible to the temporal bone. Pain associated with the TMJ and masticatory muscles is known as temporomandibular dysfunction, or TMD. During diving, the TMJ is subjected to a stress equal to what you would experience if you kept your mouth open, not fully, but as if you stuck 3 fingers into it vertically during the entire dive. This is the description by Costantino Balestra, Vice President of Research and Education at Dan Europe. This acts on the retromeniscal neurovascular bundle and may cause myalgia or headache. By having a customized mouthpiece molded, this can reduce or even eliminate the pain. Balestra is the lead author of a study on scuba diving inducing stress on the TMJ, leading to headache, published in the British Journal of Sports Medicine in 2004. The most common mouthpiece designs feature an elliptical airway attachment to the demand valve, a labial or lip flange to provide stability, and a platform that the diver bites on for retention. Mouthpieces generally feature short bite tabs and are made of soft material to accommodate use by a wide range of jaws and teeth. This requires forward motion of the jaw to effectively grip on the mouthpiece. The design may not support a posterior occlusion, which is the most effective contact of the molar and bicuspid teeth of both jaws and allows the natural movement of the jaws, which is essential for normal chewing and closure. This lack of support may eventually result in uneven loading of the TMJ. Cold water may further exacerbate this problem by impairing a diver's ability to use his or her lips to properly grip the mouthpiece. Understanding TMD. The TMJ is one of the most complex joints in the body. Its movement involves a combination of hinging and sliding actions. To locate it, place a finger directly in front of the ears, move the jaw from side to side, or open and close the mouth. You can actually feel the mandible moving in and out of the TMJ socket. The upper section of the joint is a depression in the temporal bone of the skull. The lower section of the joint is the mandibular condyle, a rounded projection at the upper tip of the mandible. These bones, which make up the joint, are covered in cartilage and are separated by a small disc which facilitates smooth opening, closing, and side-to-side movements. In many cases, the cause of TMD is not clear. TMD may occur if this disc erodes or becomes improperly aligned, if the cartilage is damaged by arthritis, or if the joint is subjected to trauma or long-term microtraumas. Researchers are still seeking to fully understand the causes of these conditions and what treatments are most effective. The reported symptoms of TMD include pain or tenderness over the TMJ area, TMJ clicking or crepitation, which is a cracking or popping sound, discomfort while chewing, difficulty opening or closing the mouth, facial pain, headache, blockage of the eustachian tubes, and even vestibular disturbance such as vertigo or disorientation, either of which could be hazardous if it occurs underwater. Several studies have noted that more women report TMD compared to men. The average age of onset is between 20 and 40, but dysfunction can occur at any age. In their study, prevalence of TMD in a group of scuba divers, Aldridge and Fenian suggested that this may be related to the anatomical differences, such as mandibular angulation and masticatory muscle insertion. Scuba diving does not appear to be the cause of TMD. However, it may exacerbate a pre-existing joint condition. The problem is that there are many people who have silent or undiagnosed conditions or just plain flimsy joints, which become symptomatic when the stresses of holding a traditional mouthpiece is imposed upon them. These are the words of Dr. Randall Moles, an orthodontic specialist and developer of C-Cure custom mouthpieces, one of several commercially available custom mouthpieces. So there's a group of people who will have no TMD symptoms prior to diving who can develop TMJ problems because they had weak joints or a pre-existing subclinical problem. So what can be done? There are a few styles of standard mouthpieces designed for scuba diving. When selecting your diving equipment, try several mouthpieces to find the style and size that fits you best. For added comfort, some divers will add a second stage swivel adapter to their regulator. That adjusts to subtle head movements and reduces hose tug. Some regulators incorporate this adapter as a standard design. If you experience symptoms of TMD during or after diving, seek a dental consultation. While most cases of diving-associated TMD resolve spontaneously, your dental professional can recommend management strategies such as muscle relaxation exercises, techniques for reducing stress, or, if necessary, medical intervention. Your dentist can also advise or assist in the development of a custom-fitted mouthpiece which requires less muscular effort to retain than the traditional design does. There are also commercially available custom mouthpieces that don't require dental consultation. The dive industry has tried to make a mouthpiece that will fit everyone, and in so doing, they had to make it soft and short due to the variability of teeth and jaws. So says Dr. Moles. A customized mouthpiece is molded to fit one person and can be made out of stiffer material that goes in the back of the mouth, which transfers the weight of the regulator to the back where the muscles are. This provides leverage and greatly reduces the force needed to keep the mouthpiece in place. In addition, because the mouthpiece can be made of stiffer material, it retains the bite marks that grip the teeth instead of the diver having to constantly bite down to get a grip on soft, spongy material, like the standard mouthpieces are made of. If you opt for a custom-fitted mouthpiece, consider the proper position for a diver. It's a common mistake that is made during molding. Balestra notes, there's a common mistake made during the molding process. People keep their heads in the neutral position. This will not mold the mouthpiece correctly. Instead, the individual should position their head as they would while diving, that is, tilting the head backwards. Some additional safety considerations. If you decide to swap your mouthpiece for a custom-made one, make sure your new mouthpiece fits your regulator's second stage. Not every mouthpiece fits every regulator, and an ill-fitting mouthpiece could incur leakage or decouple from the regulator. In addition, when attaching the mouthpiece with a cable tie, confirm tightness and use a razor blade to cut off excess and ensure that there are no sharp ends. Do not use a customized mouthpiece on an air source that might be handed off to a buddy in an emergency. It may make breathing difficult or be impossible for the other diver to use.